welcome to yet another video of Acharya Nidana Academy. In this particular video, we are going to discuss the understanding of Srotorodha. So, in what way the abnormalities in Srotas can happen in the body. Before going into this description, we need to know about some of the basic concepts to concretize. First, if you know about the physics, chemistry, and biology, and Ayurveda fundamentals, then any of the information mentioned in Ayurveda can be learned with deepest understanding. So, whenever if you want to have a deepest understanding, we have to follow the practice of minimalism. The term minimalism refers to we have to look into only one particular topic, and we have to learn that particular topic from multiple angles. For example, the concept of dosha, we have to learn from the point of Sharira Rachana point of view, from the point of Kriya Sharira, from the point of Roga Nidana, from the point of the Rashya Sureshya Kalpana, from the point of the Swastha Vrata, from the point of the Agata Tantra, from the point of the Kaya Chikitsa, from the point of Shalya Shalakya Tantra. So, like that, one particular topic from multiple angles, then we can have a deep dive understanding. So, when we want to have that particular deep dive understanding, we need to know some of the basic fundamentals. So, as far as the whole health is concerned, we need to know about what actually this functions are going to take place in a health, in a healthy individual. So, that means for that reason we need to know about the deep dive understanding of physiology. So, when you know about the physiology, then we have to have extended learning of the physiology. That is what we can say the pathology. That is extended physiology. That is we are going to learn about the pathology. So, then we need to know about what we say that the learning the further thing, that is the making the normalization of this particular pathological activities. So that means when you know about the physiology, then we are going to learn about the altered physiology. That is what is considered to be pathology. The next stage will be the restoration of altered pathology. That is what we can say, that is medicine. So that means the Kriya Sharira, Roga Nidana, and Kaya Chikitsa. Then these are considered to be connected with one another with the simple term physiology. Then whenever if you know about the patient interaction, then we need to know about the patterns. What particular patterns a particular person is following. The term pattern refers to that repeatedly occurring events. So that means whenever a person is taking a particular nidana, so that means how frequently he is consuming that particular or exposed to that particular nidana, so that is counting a lot whenever if you are making the what is actual diagnosis. For example, if a person is taking 200 ml of sour buttermilk at 10 p.m., definitely that will be having an impact on increase of pitta dosha in the body. Suppose if the person is continuously consuming for a period of 7 days or 10 days 200 ml of curds, sour curds, then we are likely to infer that the person may develop pitta dosha increase in the body. Suppose if the person is adding some amount of salt or pepper to that particular sour buttermilk, and if he is increasing the amount, for example 300 ml, then there may be a possibility of the pitta dosha vitiation to a maximum extent. So this is how we can able to look into those patterns. So that means the significance of knowing the pattern is we can check the particular pattern. So that means stop that particular pattern. In turn, we can have a creating a new pattern. In this instance, stopping the sour buttermilk consumption as well as the pattern creation, that is simple consumption of what do you say, the simple warm water or simple warm milk, etc. That can be considered as a new pattern creation. So actually the learning Ayurveda is nothing but applying this particular knowledge with physics. That is, application of physics is main component, main fundamental of learning Ayurveda. Whenever if you practice learning Ayurveda, follow one particular mentor. So why so this is important? Nowadays multiple or millions of informations are available in Ayurveda. So each and every person is having their own point of view. And if you are trying to listen all those informations, then it is just like you are keeping your leg in multiple boats. So when you are keeping the legs in multiple boats, definitely you are not going into the single direction. You may fall in the river or sea where you are standing there. Hence, following one particular mentor is very very essential to know about his past thought processes, present thought processes, and what maybe his future thought processes will be. That can be very well understood. So the next point is, whenever if you are learning Ayurveda information, you have to learn Ayurveda information as it is. And when you are learning Western information, you are going to learn Western information as it is, and try to connect those informations at regular intervals. And if you are able to connect these two informations at all those regular intervals, then that may suggest we are moving in the right direction. Hence, so connecting those informations at multiple levels, that is very very important. And lastly, learning Ayurveda should be like learning a new language. So new language in the sense, most frequently used words, we are going to learn those informations in a deep dive understanding. Then next, that is less known words, then less known words. In that way, we can learn Ayurveda like learning a new language. So coming to the word of Srotorodha. So when you think about Srotorodha or Srotodushti, so that means we can have the this understanding that could be either increased functioning or decreased functioning. So when you think about the derivation of Srotas, it is considered to be Susravani. So that means it will be having the oozing or permeating or filter or exude. These are the four different meanings are there. So when you think about Srotodushti, so that means there may be a possibility of either decreased functioning or increased functioning. When you think about Srotodushti, Srotorodha, that means there will be abrupt stoppage of functioning. That means abrupt stoppage of oozing function, or abrupt stoppage of permeating function, filtering function, or exuding function. So that will be abrupt loss. There will be abrupt loss of that observed in Srotorodha. So when you think about the Srotas as such, we need to know about the main functioning of the Srotas, wherein Sravana is going to take place. It could be capillaries. When you think about capillaries, the human body is containing around 10 billion capillaries. So when you think about the blood distribution, so in the capillaries it will be only around 7%, including arterioles and capillaries, that will be containing only 7% of the blood, whereas the 13% of the blood will be present in the arteries and aorta, and 7% of the blood is present in heart, and 64% of the blood is present in veins and venules, and 9% of the blood is present in pulmonary capillaries or the pulmonary circulation. So that means whenever there is a Srotorodha is happening, for example, if there is any obstruction is happening here, that means there may be a possibility of increased functioning in the adjacent arterioles. So that means to reach the capillaries, to reach this particular area which is distal to that particular obstruction, so that means the blood will be moving excess towards the other capillaries. So that means there is an obstruction here, a complete obstruction in the stoppage of the functioning of the Srotas there. So that means that is responsible for the increased functioning of the capillaries on these adjacent capillaries. So this is what actually happens in the whenever there is a Srotorodha is happening. So whenever if you look into those different aspects in a much deeper understanding, suppose a pathogen is entering here. This is a area where the pathogen is being entering. So that is responsible for the more and more increased blood supply to these particular capillaries. So that means whenever these are happening, so that means there will be more amount of the fluid that will be moving from the capillaries into the particular area, interstitial space. So that means in this particular occasion, this may be having poor blood circulation. In that particular sense, the blood will be coming from the other alternative route. From here, the blood start entering into the interstitial space. So like that, so here there will be initially there will be complete Srotorodha, so which in turn results in the stoppage of the blood to be present in this particular region, and there may be a possible increased blood supply or the increased functioning of the Srotas, that is Sravana, is going to take place through the alternative route. This is what actually happens in cases of Srotorodha. Why Srotorodha is important? To make the exact diagnosis and to know about the impact of Nidana in the body, to know about the actual prognosis, and to know about the impact of management. So these are the 4 different areas where we can have a better understanding. Now first thing about the diagnosis. Why? So this particular Srotas is helpful in making the what you say that the in the diagnosis aspect. That means first of all regarding the body strength. So whenever if you think about the Srotas as such, it will be the impact of this particular Srotodushti. So that will be multifactorial. So first of all, body strength. So that will be having an what you say the major role to know to decide which particular Srotas is being affected. So whenever if you say about the entry of dust, all the people who are having the dust exposure, they may not have sneezing. The people who are working in those particular areas where dust are common, they may not have that particular sneezing effect until and unless if they are exposed to more and more amount of those dust as such. Whereas the persons who are new to these particular dust or smoke, they may show the sneezing, etc. So that is actually depending upon the body strength. Then number of Srotas is affected. So that means whenever a person is having the what you say that the cold air, there may be a possibility of affliction of pranavaha Srotas. There may be a possibility of affliction of what you say that the annavaha Srotas also. Why? Because whenever pranava Srotas affliction is there, there may be considered to be the continuation of what is Mahasrotas is also coming under this particular Pranavata dysfunction. So that means as a continuation of Pranavata, there may be a possible affliction of Annavata Srotas also. So like that, the number of Srotas affliction also counts a lot when you are making the what is exact diagnosis. Sroto Mula afflicted. Whenever a person is suffering from what you say that the increased Metodhatu. So that means naturally, or what you say that the adipose tissue increase in the body. The first and foremost affliction we can suspect is Medosrotas affliction. It is also being said that Medas is a Srotomula of Astivah Srotas and Svedavah Srotas. So that means in due course of time there may be a possibility of affliction of Astivah Srotas as well as Svedavah Srotas also. So in that particular situation, so the diagnosis of a disease is of utmost important. Then comes the number of pathogens are involved in the pathogenesis. If less number of pathogens are being affected in a particular Srotas, the person may have milder Srotorodha. If the more amount of the pathogens are being affected or afflicting the Srotas, the person may show severe Srotorodha. Virulence of pathogen. You think about virulence of pathogen. The person who is having the most virulent pathogen, so that is being affecting the Srotas, the person may show severe Srotas dysfunction. If the person is having mild virulent pathogen, the person may have milder Srotorodha or milder Sroto dysfunction. Then regarding the entry of pathogen into the Srotas. So this actually helps in knowing about the how many Srotas are being affected. So whenever if you think about the entry of pathogen, they may enter into the 9 natural orifices in males or 12 natural orifices in females. Or otherwise there may be a possibility of entry of pathogen that may happen in the skin through the cut wound. So like that, the multiple ways the person may have an impact. When the impact or entry of pathogen is happening through the mouth, there may be every possibility of the altered digestive function. So that means the person may develop Nija Vikara. If the entry of pathogens are happening other than mouth, in other orifices, the person may develop Agantuja Vikara. The person may develop Agantuja Vikara. So this is how. So the impact of Srotas will be helpful, or do you say that in the diagnosis of a disease. So when you think about the impact of Nidana, so here there is a Srotas is being present, tubular structure which is having 5 different organs, 1, 2, 3, 4 and 5. So here let us say, so these are the 3 different entry of pathogen points, and Srotomula A and B, let it be the Srotomula, and the direction, so that is being with the blue direction, that is the arrow that indicates the Srotas is functioning from A to B. In that particular situation, the source of entry of pathogen, so that may have a different impact in the body. Suppose if the entry is happening through the A region, so that means the initial affliction will be taking place in the 1, then 2, then 3, then 4, then 5. Why? Because the movement of the contents is happening from A to B. In that particular situation, suppose if there is any entry of pathogen is taking place from the 2, that is E2. In that particular situation, as the movement is happening from the A to B, the affliction you are going to see only in 5, whereas the affliction of Srotas is much delayed, and 3, 2 and 1, they may rarely being affected because the movement of the substance is happening from the A to B. Suppose if there is any even the pathogen is entering through the E3 region, so that means, so the initial affliction will be taking place in the organ number 2. Then you are going to expect organ number 3, organ number 4 and organ number 5. Whereas organ number 1, so there may be a possibility of involvement will be very remote, because the movement of the that the entry pathogen is going to take place from A to B. Hence, so the entry of pathogen is happening at the 2. That is the reason the movement will be taking place in this direction only, not towards the 1. If there is any obstruction is there at 2, then there may be a possibility of involvement of organ number 1. Other than that, there is no possibility of involvement of organ number 1. So this is how the impact of Nidana will be considered in deciding what actually the Srotas abnormal function. Then next about the Srotas, that is the prognosis. When you think about the prognosis, the first and foremost, let us say M, N and O, 3 different persons in one. So the pathogen is present only in alimentary canal. Whereas in 2, that is the patient number N, the pathogens are present in the intravascular compartment, interstitial compartment and intracellular compartment outside the bones. Whereas of the person number 3, the pathogens are present in the intravascular compartment, interstitial compartment, intracellular compartment inside the bones and joints and marma. In that particular situation, so the person who is having the pathogen only at the that the alimentary canal, it is very easy to treat. Whereas if the pathogens are present in the intravascular compartment, interstitial compartment, intracellular compartment outside the bones, joints and marma, so we need to do little bit extra work. Whereas if the pathogens are present in the intravascular compartment or interstitial compartment or intracellular compartment inside the bones, joints or marma, we need to do even much extra care to bring the dosha from those into the alimentary canal. So hence the person who is having the pathogen in the M, it is easy to cure, whereas in case of N person, so we need to make much extra care, whereas in case of O, it will be very very difficult to bring from the compartments into the alimentary canal. Then impact of food management. What actually management refers to as far as Ayurveda? So the management refers to the bringing the dosha or the pathogens from the intracellular compartment or interstitial compartment or intravascular compartment into the alimentary canal. Asanna Marga Harana is considered to be the main Chikitsa Sutra. Whereas movement of the dosha or pathogen is happening from the alimentary canal into the intravascular compartment or alimentary canal into the interstitial compartment or alimentary canal into the intracellular compartment, it can be considered as pathogenesis. Whereas the movement of the pathogens from the intracellular compartment to the alimentary canal and the pathogens present in the interstitial compartment into the alimentary canal and the pathogens, if they are present in the intravascular compartment into the alimentary canal, that is considered to be the line of treatment. So this we need to remember. Whereas the take home messages from today's discussion will be: Srotas is considered one of the essential component of Roga Nidana subject. Abnormal functioning can be either increased functioning or decreased functioning. Whereas the knowledge of Srotorodha can be helpful in making the accurate diagnosis and to determine the impact of Nidana in the body, to accurately predict the prognosis of the disease, to plan the right kind of management. That's all for today. Dear ANA members, if you are getting some value added information, then like this particular video and mention the major key takeaways from today's session and what kind of the session would you like to have in the coming videos, mention below. If you are truly liking the video, then spread the video to maximum true Ayurveda learners. Let's make a huge impact out of this particular small message. Thank you. We'll meet in the next video by a new different topic. Thank you once again.